What are the causes of pregnancy symptoms with a negative test? What are the causes of pregnancy symptoms with a negative test? Do you feel pregnant? Are you experiencing the pregnancy symptoms, and yet every time you do the pregnancy test, the urine pregnancy test, it comes out negative? On this channel, we are going to talk about the cause of pregnancy symptoms with a negative test after this message. Hello, welcome to our channel. I'm Gerald Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. First cause for a negative pregnancy test and yet you are feeling the signs of pregnancy is what we call premenstrual symptoms. These could be premenstrual symptoms. Premenstrual symptoms basically is a collection of the signs and symptoms, the collection of what you feel when you are about to go into your menstrual cycle. The signs you get, the symptoms you get before seeing your periods, they do mimic, they actually do look like the pregnancy has happened, but yet you may really be surprised, because what happens is this: when you are about to see your periods, what we call the premenstrual symptoms, there's an elevation, or the hormones, specifically estrogen and progesterone, tend to be very high in your bloodstream. So when the two hormones, that is estrogen and progesterone, increase in their amount, then there are high chances that you will begin getting the pregnancy-like symptoms, and yet you are about to see your period. So our first cause for pregnancy symptoms and yet you have a negative test is what we call premenstrual symptoms. What you need to do is you have to really be patient a bit and wait, because if you see your periods, then it confirms that you were experiencing premenstrual symptoms being brought about by a high increase of the pregnancy hormones, that is the estrogen and progesterone. Remember to hit the like button for new videos we put out every day on women's health. Without further ado, we shall go to our second point, and this is our second point is that you might have tested very early. Another sign, another cause of pregnancy symptoms, and yet you are actually doing the test and it is turning out to be negative, is you might have tested the pregnancy test when it is very early. We normally recommend that if you miss your periods, let's say you miss your periods to this month, let's say you are supposed to see your periods maybe today, but you do not see your periods, the best advice is wait for at least 2 weeks, or even like 1 week. It's just very adequate, and then do the pregnancy test. You can do the urine pregnancy test after 5 days or 7 days after missing your period. So the next cause of pregnancy symptoms and yet you have a negative pregnancy test is testing very early. The first point was premenstrual symptoms. The next point is testing very early. We shall go to our next point, and this specifically, you may be pregnant with twins. Causes of pregnancy symptoms: you are feeling like you are pregnant and yet the test is negative. You may be pregnant with twins. Whenever a woman is pregnant with twins, yes, the test will turn positive after some time, but normally when you do rush to do the test, sometimes pregnancy with twins, normally due to the surge and the increase of the hormones due to the twins, you may actually begin seeing a negative test and yet you are pregnant with twins. So the best advice is to wait and at least give it like 2 weeks. If at all you are not really so sure, you can always go talk to your doctor or share this with your midwife. They will advise you on what you need to do. For appearing the negative pregnancy test happening, but yet you are feeling pregnant, is what we call irregular menses. Irregular menses or irregular menstruation days or irregular periods may be brought about by an imbalance in the hormones. We talked about this in our introduction, and we said that specifically the hormones estrogen and progesterone, much as there are other hormones, for example the luteinizing hormone and the follicle-stimulating hormone, but the first two hormones, that is estrogen and progesterone, do play a very big role in how a woman is going to be experiencing her periods and how regular are they going to be. If these hormones, specifically the estrogen and the progesterone, do not balance due to conditions like maybe disease, due to overstressing yourself, in most cases you may end up with pregnancy symptoms and yet you are actually not pregnant. Next point for getting pregnancy symptoms and yet you are not pregnant is you may be having what we call an ectopic pregnancy. You may be having what we call an ectopic pregnancy. An ectopic pregnancy specifically is a pregnancy that is outside the uterus. An ectopic pregnancy is a pregnancy that is outside the uterus. So if you get pregnant, that is, if fertilization takes place, ideally the fertilized egg, also known as the zygote, is supposed to travel through the whole length of the tube up to your uterine lining or your endometrial lining, and then it attaches there, and then it grows up to 9 months when you give birth to a happy and lively baby. But if at all the implantation does not really take place and the fertilized egg remains in the tubes, specifically due to adhesions or infections in the tubes, or even women having lengthy tubes, if the egg that is fertilized remains in the tubes, then we call this an ectopic pregnancy. And since the attachment of the fertilized egg did not take place in the uterus, then there are high chances that there's going to be the point of irregular or unbalancing of the hormones. The estrogen and the progesterone may actually not rise, they may actually be imbalanced, and these may bring about all these changes. For having pregnancy symptoms and yet you are actually not pregnant is what we call pseudocytosis or phantom pregnancy or false pregnancy. You may be experiencing what we call a pseudocytosis or a phantom pregnancy. Specifically, these are terms to mean that you may actually be having a false pregnancy. This is very common in women who have a strong desire of getting pregnant. The mind actually goes on and confuses their endocrine system. The endocrine system is that system that is responsible for producing hormones, and specifically these hormones, we've already talked about them, the estrogen and the progesterone. So if your mind goes on and tricks this system that yes, this woman is pregnant and yet you are not pregnant, you may actually get these symptoms. Remember, the pregnancy hormones, they are mainly four, but specifically we are talking about the estrogen and progesterone. This is produced by the anterior pituitary gland. They are produced by the anterior pituitary gland. And what normally regulates this anterior pituitary gland to produce the estrogen and the progesterone is what we call the gonadotropin releasing hormone. This is produced by the hypothalamus. The hypothalamus and the anterior pituitary gland, these are parts of your brain. So if your mind is always thinking about pregnancy, there are high chances that these two parts may be tricked into thinking that you are pregnant, and normally this is more of like a psychological issue. But if at all you overthink about pregnancy and you test for pregnancy almost every time, sometimes it may actually bring about what we call a pseudocytosis. The only way to confirm all these The only way to confirm whether you have any of what we've talked about is by doing by having an ultrasound scan done by a competent person, by a doctor. They should do what we call an ultrasound scan, and then also, depending on the country where you are, you may also do what we call a blood pregnancy test, testing for your pregnancy, testing for the pregnancy hormone known as the HCG, but specifically testing your blood. Remember, this is a summary of what we've just talked about. Our topic for today was the causes of pregnancy symptoms, and yet you are pregnant. And yet you have a negative test. Our topic for today was causes of pregnancy symptoms with a negative test. You feel pregnant, but you have a negative test. You are getting all the nausea, all the tender breasts. You are actually having cravings for food, but every time you test, you have a negative test. So we've talked about the causes, and we've said that the first is premenstrual symptoms. The next is testing very early. The next, pregnant with twins. The next is irregular menses. Next, ectopic pregnancy. And lastly, pseudocysis or a false pregnancy. Thank you for passing by. I hope you've learned something in today's lesson. Let me know if you have any questions down below in the comments. I will answer all your questions down below in the comments. Subscribe, like, and hit the bell for notifications. But remember to subscribe so that you get all the new videos we put out about women health, about pregnancy. Gerald Massa, the health educator. I'm really so happy that you've spent this time with me. I hope you've learned a thing or two. Have yourself a fantastic and healthy day, and talk to you again. Bye-bye. May God bless us all. Bye-bye. Hello, welcome to our channel. I'm Gerald Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.